Hi everyone, my name is Elise Marsh, and today I will be talking about the chronic disease of stroke. It is estimated that there are more than 4.7 million stroke survivors in the United States, and about 795,000 Americans have strokes each year. In addition, stroke is the third leading cause of death in the United States and is considered a major cause of disability worldwide. There are many factors that put an individual at risk, but to discuss them, they should be divided into categories. The first category would be the risk factors that a person cannot help. Genetics provide individuals with many risk factors, and stroke risk increases with a strong family history of hypertension, atherosclerotic disease, and a diagnosis of aneurysm. Smoking, obesity, substance abuse, sedentary lifestyle, and the use of oral birth control are all risk factors that are placed into the category of factors that can be changed by the patient. According to the National Stroke Association, stroke occurs when blood flow to an area of the brain is cut off. When the blood flow to the brain is stopped, it ultimately results in brain cells dying. Memory loss and the loss of muscle regulation are a result of the brain cells dying in the respective areas of the brain. There are multiple types of strokes, and each affect the brain in a different way. An ischemic stroke occurs when the cerebral artery is obstructed. Thrombotic strokes occur when fat plaques make their home in the arteries, and these plaques increase the risk for a clot, and the clots that form can eventually cause a disruption in the blood flow within the artery. An embolic stroke occurs when a chunk of fatty plaque or a thrombus breaks off from an area in the body and moves to the cerebral arteries. An embolic stroke is common in patients who have been diagnosed with atrial fibrillation or AFib, myocardial infarction or MI, and those with prosthetic heart valves. Lastly, a hemorrhagic stroke occurs when blood vessels break, and as a result, there is bleeding in the brain. Depending on the type of stroke and where it occurs, the symptoms can differ. Some symptoms are not commonly associated with stroke, whereas others are well known. Uncommon symptoms include, but are not limited to, bladder incontinence, decreased sense of touch, personality changes, headache, etc. And more common symptoms that people are more likely to recognize are weakness, numbness, or the inability to move one side of the body normally. Those who are suffering or have suffered from a stroke may experience difficulty swallowing or difficulty communicating. Vision changes may also be present, and patients may experience blurred vision, loss of peripheral vision, sensitivity to light, or in some instances, they may lose vision on one side, which is known as hemanopsia. Depending on which side of the brain the stroke is, language, memory, vision, behavior, and hearing can all be affected differently. It sometimes occurs where patients are unable to recall names of family members or have no rhyme or reason to the activities that they are doing at home prior to being diagnosed with a stroke, and they may have a difficult time performing tasks they would normally have no problem doing. Cultural considerations should be made for every patient with an illness or condition. Religion can play a major role on what extent of healthcare people can receive. In the Jehovah's Witness religion, blood transfusions are not acceptable even in the event that it could save a life. These beliefs are pulled from scripture, such as that from Acts 15:29, which states, "You are to abstain from food sacrificed to idols, from blood, from the meat of strangled animals, and from sexual immorality. You will do well to avoid these things. Farewell." And that's from the New International Version. Other religions, such as Christian Science, believe in healing through prayer, and these patients may not even seek medical help and will be cared for and prayed for by those at home and within their religious community. Care in the event of a stroke should be sought as soon as any abnormal symptoms are noticed by the patient or family. Diagnostic testing should be performed as soon as possible so that treatment can be given if applicable. Different testing available for diagnosis of stroke can include a carotid ultrasound, computed tomography or CT scan, CT angiogram, cerebral angiography, positron emission tomography or a PET scan, and magnetic resonance imaging or an MRI. The NIH scale or the stroke scale can also be used to diagnose the severity of stroke symptoms, and that scale assesses and scores patients based on functionality of level of consciousness, gaze, visual fields, facial palsy, motor function of arms and legs, limitaxia, sensation, language, speech, and inattention. And when assessing a patient using the NIH stroke scale, patients are shown pictures and asked to describe what is happening in them, just like that picture down on the bottom of that slide. They are also shown simple phrases and asked to read them. As for preventative tools, patients can take a prophylactic aspirin every day and change some risky behaviors such as smoking to prevent the likelihood of a stroke. Education on self-management and home care after discharge are crucial for the safety and well-being of patients. Patients may be instructed to perform simple range of motion exercises or to attend physical therapy. They should also monitor themselves and have family monitor for depression, as depression after stroke is a major problem because it can cause or it can increase morbidity. And patients are very likely to experience emotional distress after a stroke, and it's important that a patient have a quiet and consistent environment when returning home. Stroke patients' homes should also be adjusted to be easy to ambulate around, and patients should know that they will need frequent times of rest. Lastly, adherence to medication therapy is vital after leaving the clinical environment to help ensure that another stroke is not as likely. So as you can see, stroke can be a very complex disease. It's important for those who are at a higher risk to take the necessary precautions to avoid a stroke if possible, and for everyone to be educated on the physical presentation of a stroke. The long-term effects of stroke can be cumbersome. However, with a good healthcare team and commitment by the stroke survivor, the lasting symptoms can be managed. And this is a list of the references that I use if you guys want to look over those. And thanks for listening.